Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. March is Colon Cancer Awareness Month, and even though we've just got a few days left in Colon Cancer Awareness Month, our guest today is Gina Neri, Mrs. Gina Neri. She's here today to talk with us about being diagnosed with colon cancer at the age of 39 while pregnant with her third child. Thank you so much for joining us today, Gina.
Thank you so much for having me.
Now, March being Colon Cancer Awareness Month, I couldn't think of any better way to get awareness out there than to have someone who has been diagnosed with colon cancer and who's living and sort of survived with it under such tremendous circumstances. Tell us a little bit about yourself.
Well, I first off would like to say that I really didn't have any early warning signs. Mm-hmm. I was in fairly good health, working as a lawyer, busy, had a family already, 2 children and a husband, and just suddenly one day had one instance of rectal bleeding. Mm-hmm. And, that luckily scared me enough to prompt me to call my primary care doctor and go in and see her right away.
Okay, so you were healthily afraid, and you got something done about it. Was there any pain involved? This was just all of a sudden, just boom, out of nowhere, nothing?
Yes, no pain whatsoever. It was other than being scared, I actually felt no pain. It was mentally scary, but physically, I did not feel any pain or sickness or anything. It just scared me enough to call up my primary care doctor and go see her. And ultimately, it turned out to be the right move. While I was there, she took a very thorough medical exam. And during that exam, she asked me about my family medical history and my health history. And I have no cancer in my family. And as I stated before, I was in relatively good health. Now, I felt very lucky that she took the rectal bleeding very seriously because I had just had a child a year and a half ago, and she could have chalked it up as hemorrhoids and kind of said, let's just wait and see and take that approach, see if it happens again in the next 6 months and then do something about it. But instead, she decided to, as a precaution, send me for some rule-out testing and then have me see a gastroenterologist. But during that visit, she had gone over whether or not I thought I was pregnant, and I did not think I was. And she said, well, let's just throw in during the rule-out testing a pregnancy test just to be sure. And that very night, surprising enough, I was pregnant. I had no idea.
So you've got some very serious things to deal with overnight.
Right. And so I went and saw the gastroenterologist right away. I was lucky. She had made the appointment for me. So I was able to see him right away. In fact, within the next day or two. And he immediately was concerned, obviously about the rectal bleeding, but also about the pregnancy. So he wanted me to do, he didn't want me to do a colonoscopy because of the anesthesia that goes along with it. So I did a sigmoidoscopy, which meant I was awake during the procedure. And so within a few days of learning, I was pregnant with my third child. And right as my husband and I were just kind of digesting that, we learned a few days later that I had colon cancer. And what's shocking is when I saw this big green blob on the screen, I mean, the even more scary part about it is that I was actually awake and saw it and said to my gastroenterologist, what is that? And he said in the most serious voice that I had never heard from him before, is you're looking at colon cancer. And then my journey began. It was so scary. And it was Friday at 5:00. So never get a test like that at that time.
It does sound, though, like your medical team, your support group acted very quickly, no hesitation, no improper diagnosis. Now, you've become an advocate for lowering the age at which folks are getting screened for colon cancer. Being that involved as an advocate, is misdiagnosis something that you hear about in your efforts to bring awareness to colorectal cancer? It didn't seem to happen in your experience, but have you heard of any of that in your experience?
Yes, I was very lucky. I think that each doctor that I had was extremely on top of things and very proactive. However, through my journey, I have met several people. I'm part of a support group of over 3,000 members with colon rectal cancer, and there is quite a few under the age of 50, and many of those people were misdiagnosed, unfortunately. They were not taken seriously. Their doctors did take the wait-and-see approach or diagnose them with colitis or some other form of gastroenterology or gastro issue, and never tested them for colon cancer because they didn't think that that would even be a possibility. So, yes, I was very lucky. And yes, as part of my advocacy, I do want to spread awareness that taking a medical history and being thorough and allowing the awareness to the medical profession, just like Dr. Wishner said, will, encourage doctors to also think about the fact that it's possible that people under the age of 50 could get colon rectal cancer.
Now, you mentioned Dr. Wishner as part of your care team, your support group. When you found out, that you're pregnant, you've got colon cancer, big enough for you to see on the screen, because you're awake, what went through your mind as far as carrying your third child safely?
Well, he was so I was diagnosed on Friday. He was the gastroenterologist had advised me to go consult with him. Of course, I didn't know who he was. And so he was the first surgeon that I consulted with. And when I consulted with him, even he was a little hesitant, but he did talk about this robotic assisted surgery. And I had never heard of robotic assisted surgery, so I was very interested in learning about it, but, also a little leery about it at the same token. My husband and I, after consulting with Dr. Wishner, went off and did get several other opinions. We happened to be lucky to be in the backyard of New York City, so we went to several top institutions to consult with other surgeons who advised us, the majority of them, to terminate the pregnancy and have the surgery the next day. And it was very scary.
Wow. Now, you obviously elected to do something much different. After many of these opinions, did you come back to Dr. Wishner and have the surgery? And if so, what type of surgery did you have?
I ended up going back to Dr. Wishner. I also did my own independent research on the robotic assisted surgery, and I felt like one of the things that Dr. Wishner said during my consultation, which I'll never forget, is, I'm a surgeon. I've been doing this for 25 or so years, and, I have a very steady hand and a precise cut, but would you want a surgeon with a 99% precise cut, or would you want to have surgery with 100% precise cut? That's of course, I want 100%.
Yeah. Absolutely.
And so, especially under the circumstances, because I wanted to keep my pregnancy and my baby more than anything. Yeah. So, yes, I went with the robotic assisted surgery.
Were there different types of robotic assisted surgery offered to you as options, or was there one that stuck out as the glaring option?
Well, I don't know if there exists any different for colon rectal cancer. That would definitely be a question for my surgeon, but I know I use the Da Vinci system of the robotic assisted surgery. That I do know.
with the colon and the uterus in such close proximity, part of the reason that they suggested that you terminate your pregnancy was because they were so close and because it was so traditional surgery being so invasive. Did your own research, were there other forms of invasive surgery that were, I guess, a little bit less invasive than the normal traditional that you could have gone for before the robotic surgery?
I could have done a laparoscopic procedure as opposed to an open procedure, which might have been less invasive also. But again, that would have been with a surgeon's hands using the equipment. And again, I'm not saying that the surgeon wouldn't have done a good job. Of course, we'll never know because I didn't go that route. But, I was convinced, especially after hearing what Dr. Wishner had said about the 100% precise cut, I was adamant that that was the best way to go. And ultimately, I think it was the best way to go.
We touched on your advocacy a little earlier in our discussion. You started a foundation that deals with young people as far as screening, colon cancer in general. Talk about this foundation that you started.
Well, my foundation actually isn't fully in existence yet, but I'm in the process of opening it or starting it. It's called Gianna's Hope in the name of my daughter. Her name is Gianna Hope. And basically it's to support and spread awareness about colorectal cancer for the people under the age of 50. I have a vision and a mission to distribute information, but to advocate to lower the age of testing for colon cancer. And I also believe that through time, there's going to be more and more people that are going to find themselves pregnant with colon cancer, since there's an increase in this younger population getting colon cancer. And so I want to be able to help those that find themselves pregnant with colon cancer, because I was lost and I really didn't know what to do. And I was fortunate that my husband and I had some time and I guess money to do some investigating and traveling to try to meet with different experts. And, we also did our own independent research, but, it shouldn't maybe be that difficult, but it was. And it was one of the scariest decisions of my life. I hope I never have to make any type of decision like that before. And I want to just be able to help people if I can.
What is the one thing you'd like to tell these women that are going to find themselves pregnant and fighting cancer at the same time, just like you? What would you like to tell them when they first hear the news? What type of support would you like to give them today?
Well, I'd like everybody to understand that they are their own self-advocate. They know their own medical history better than anyone, and that they need to listen to their body. And if something isn't right, they should go see a doctor and follow up on it. And if for some reason the doctor is telling them something that just doesn't make sense to them, they should go seek another opinion. Also, if for some reason somebody else is ever devastated like I was and finds themselves with cancer and pregnant, whether it's colon cancer or any form of cancer, there is a registry out there called Hope for Two. And that is certainly a very nice starting point to gather some support under this unfortunate predicament. And then maybe that'll help them at least learn or get some comfort from other people who have been through this journey, and also join some Facebook support groups about colon cancer and pregnancy, or colon cancer in general, because there's a lot of people out there who've been through this, maybe not the pregnancy portion, but there are people who've been through colon cancer before, and these people can help guide, support, pray, listen, and be there for them when they're going through some really tough times.
Well, I sure appreciate you coming in and speaking with us today.
Thank you very much for having me and covering such a very important topic.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Mrs. Gina Neri. We've been here talking about her story, her recovery, and the breakthrough surgery known as the Da Vinci method that has her back on her feet and doing very well. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.